Hello and welcome to the Research Series program. Economics students, you must be familiar with randomized control trial or RCT, which is the golden standard for impact evaluation. And in today's research series, we are going to discuss one recent study that utilized RCT to assess the impact of an integrated social safety nets on child development in Burkina Faso. Now, that's a country that we rarely heard in conversation in Indonesia, and it should add interest on today's research series. So the study was conducted by a team of researchers, and we're lucky to have one of them here, Professor Richard Akresh from the University of Illinois, Urbana-Champaign. Welcome, Richard, to the research series program. Thank you for coming here. How are you?
Thank you. Thank you very much.
Yeah, I hope you enjoy Jogja. Yeah.
Yes, it's a fantastic visit so far. I love the hospitality is amazing.
Thank you so much, and we're very lucky to have you and the presentation yesterday.
Thank you.
Right, so let's start with the first questions. So many social programs rely solely on cash transfer to support low-income households, and your study integrates cash transfer with information meetings and home visits. So why this is necessary, and what is the economic rationale that supports it?
So that's a good question. And so right now around the world, many governments, both in Africa as well as historically in Latin America and in Asia, have used cash transfers to help poor people, poor families, right? So they're trying to provide social safety nets for these poor families. And yet, despite these programs and these cash transfers, we have hundreds of millions of children around the world who are not yet reaching their full potential. That could be both on the health side, on the education side, on the growth and development and cognitive behavioral side. And so there's an effort that's going on right now where governments are looking at sort of alternative and supplemental programs, complementary programs to say, okay, if we provide a social safety net, what else can we do to help these children reach their full potential? And so working with the Burkina Faso government, we came to the idea that where we started thinking about where are the constraints that these families are facing. And so the two areas that we identified in the Burkina context is that information may not be readily available. So it may be the case that these families don't know what are the best practices in terms of feeding, in terms of nutrition, in terms of medicine, in terms of things like how to treat your child if he has diarrhea, in terms of the importance of bed nets to prevent malaria. So a whole range of information-related ideas that maybe not all of the families know about or know how to implement or when to implement it. So there's World Health Organization guidelines about breastfeeding and when to introduce solid foods. Maybe the parents don't understand at what ages they should be doing certain things. Okay, and so the idea was maybe it's an information constraint that if we provided information to these families, that might be able to help their children. And then thinking further about some countries have recently started adopting these home visits where they start thinking about the quality of parenting behaviors. Can we help parents be better parents? Okay, and so partly that's an information thing, but it's partly changing social norms about how do you raise children? What are things that are important for brain development for your child? Thinking about these kinds of ideas led us to say, okay, let's set up an RCT where we could compare, if we only give you cash, what impacts do we have? If we give you cash plus add on these village level information meetings, what happens? And then lastly, if we give you cash plus information plus a home visit to reinforce that information message, what happens to these outcomes for these children?
Okay, so from what I understood is like it's the information is like the basic required knowledge for this household to better utilize the cash transfer.
Correct.
And that is like the kind of the justification on why you need to do that intervention.
Right. So it's part of, in the context there, every country is different. And so, I don't want to say we necessarily should be doing this program everywhere. But certainly in the context of Burkina, in the rural areas where we were working, in these villages, there are many families, you talk to mothers who don't necessarily understand kind of what they can do to help their children. And so this was a program designed with the help of the government in Burkina to say, okay, what information is critical that needs to be given to these families to maybe help their children reach their fullest potential.
And that's supposedly better than having like separate intervention for, these home visits and information provisions rather than like combining them.
Well, so that's a great question. So we don't know if you only did a home visit what you would get. So from our study, we can't necessarily answer that question, right? But we know that there's been lots of evidence around the world that cash transfers have really large impacts, right? And so we know there's been randomized control trials in Latin America and Africa. I've done work previously in Burkina, and so we know that cash transfers are quite effective at helping these families. And so what we were trying to do in this study is say, okay, even if you give the cash transfer, there's still many, many children who are not benefiting, who are not improving. What else can we do on top of that to really help these kids?
Okay, thank you. So I'm gonna move on to the next question. Yeah. So actually, this next question is already partly answered by your your answer before. So your research finding say that home visits were more effective than cash alone in improving early child development, and partially that may be explained because of the it is like the basic knowledge necessary for them to understand the use of the cash transfer. But do you have anything else that you can explain to us? How does like it influence family behavior in ways that just cash or general information cannot?
Okay, so this is a great question. I mean, so there's kind of two parts to the answer. I mean, the first is that we really don't know, we're not 100% sure why the home visits were so effective, right? We have some hypotheses, we can rule out some things, but at its core, what we're able to say is that if you provide a program in this way with cash plus information home visits, you'll get these large effects. Understanding the mechanisms of why we get the effects is a little bit more speculative. And so I don't want to necessarily say like, we know for sure it's this. So one of the things that we've thought about, and we've gone back after the survey was done and after the analysis was done, went back to these households and kind of informally talked to them in more of a qualitative way, just having kind of group discussions. And one of the things that came up frequently was this concept of salience. Right, so these are very remote villages out in rural Burkina Faso. These are subsistence farmers, very, very poor families. And so they had this view that the government, by sending a social worker out to their household, sitting down in your household with your family, kind of sitting on the floor or sitting on a stool with your family, it showed them that the government really cares about this family. And so then they're like, wow, the government is coming from the capital, which is hundreds of kilometers away. They're coming to not only to my village, they're coming to my house to talk to me about my children and how they want to give me knowledge to help my children grow up to be healthy and successful and get jobs. And that kind of was really a powerful motivating factor. I don't know if it's the only factor. We also think that it's important, when we look at why did the home visits have an effect, whereas the information alone didn't. So one idea we have is that maybe, these families, they go to the information meetings, they see the information, maybe they don't understand it, like how does it apply to them? Maybe there's bottlenecks in the family, so maybe there's husband versus wife decision making that's going on. Maybe the husband didn't go to the meeting, he doesn't understand why should we do these new things. And the home visit allows the social worker to kind of explain like, hey, here's why we need to do this. We talked about these things. You remember last month we learned about buying soap to use after the latrine. Here we talked about covering your water jar so the purity of the water is higher. So things along those lines. And I came to your house. Maybe you haven't done that yet. Maybe you left the meeting and you're like, oh, I should go do that. And then you got busy with work and farming, and so you forgot to do it. And now I'm here reminding you, helping you do these things. So it could be the repeated visits that matter. Like we go back every few weeks where we're going back to these families and saying, hey, you remember we learned about this? Let's go put it in place in your family. We can't kind of rule out which of these things is driving it. But in talking to the families, the salience of the government caring about you came up a lot of times in these meetings.
Yeah, I can resonate with your experience before. Yeah, I used to, I think last year, me and a couple of staffs from the faculty visit family of one of the recipient of scholarships in one of the remote island in Indonesia, and yeah, first they do not believe that we came for them,
Right.
but then when we came up, when we shake their hands, they look really happy.
Yeah.
And that also brings me to my next questions, because when I'm going to that remote island in Indonesia, it's far away from Jogja, but it's still quite easy to reach using airplanes and so on. But I cannot imagine doing this in in Burkina Faso, in African country. That must really have some significant challenges. And can you explain to us what were the biggest challenges that you faced, and what can policymakers learn from this experience?
So a really good question. I mean, so every country is going to be different, and so I can give you examples of the challenges we faced in Burkina. I'd be I don't want to generalize to all of Africa, because of course there's differences across countries. So one of the things is that this is a project that we were doing with the Burkina Faso government at scale in many villages with thousands of households, and so all of that is an advantage in the sense that when we get these results, we know that this is a real world policy that the government has implemented, which tells us, like, we can expect this is what you would get if another government tries this, or if the government tries this in another part of the country, right? It's very different than when you started the podcast talking about the RCTs and randomized evaluations. Oftentimes those are done in a very small scale pilot setting with an NGO, and in a setting where the researchers have an enormous amount of control over exactly how the intervention is formulated and how it's done and supervised and all that. Here, we had meetings, of course, with the government, but then it was their project. And so that's good and bad, but it tells us a lot about how the project will work if a government's running this program in some other setting, right? So to give you an example of the obstacles, the original grant for the project was supposed to be from 2015 to 2017. Okay, but once we reached out to the government, we had the funding to do the evaluation, and they said, we're not ready yet, call us in 6 months. And so then every 6 months we would call them, and they'd be like, nope, we're not ready yet. Next 6 months later, nope. January, nope, we're not ready. June, nope, we're not ready. And so it kept going on for a number of years until in late 2018, where they said, okay, we're ready. Next week we're going out to do the intervention. And we're like, wait a sec, we can't do the intervention until we start the baseline. Give us 2 or 3 months, we'll do the baseline survey, and then we'll go do the intervention, right? So there were, and then even then, once the intervention started, the cash transfers were delivered immediately right after the baseline survey, but the home visits and the information meetings, the government had delayed hiring and training the community health workers who were going to do these interventions. And so that part of the treatment didn't get started until a year later. Right? And so when we talk about these end results, we have 2.5 years of cash transfers and 1.5 years of information meetings and home visits. So at the end, it's kind of a package, a bundle, but not everything started on day one, right? And because some of it's because the government ministry that we were working with wasn't ready to train the health workers and the social workers to go out. So that adds time. And then, of course, like many researchers, this COVID fell right in the middle of the intervention, and so things stopped for a number of months in Burkina, while everyone around the world, I'm sure here as well, was trying to figure out how do you deal with COVID and all of the issues there.
Yeah. So government ownership is important, yeah, at least in the case of Burkina.
For sure. And I think that's true in many contexts, right? And so understanding, building a partnership with the government will, allow them to experiment about which components of these programs are important, and maybe to test things. In this government here, we think, parts A and B and C are potentially important, and maybe the government also thinks D and E are important, and so we can then test, some of these different pieces to see which ones are relevant in that context.
Okay. But is there any, so again, it's going to be the next question. Yeah.
Sure.
So you mentioned before that the government will say that component ABC is probably going to be important for them, but from the perspective of the methods that you, from the research that you did, what are the components that are like the essential ones that we cannot let the government, dictate on that component?
Well, I mean, on this project, so we had a setting where the government was convinced that they had to do cash transfers, right? And so they had to provide cash transfers to all of these poor families. These are again very, very poor families. They're subsistence farmers. They're on the margin with climate change facing many of these farmers in Africa. Their yields are declining over time, and so helping these families was very important to the government. And so providing cash was a non-negotiable. So they said everyone who's below the poverty threshold will be getting these cash transfers. Then what they were willing to do is to experiment with what additional add-ons, what additional components might be relevant to further help these families. And that's how we ended up with the village meetings and the home visits, as these kind of, everyone wanted to get cash, and so they're rolling out a cash transfer intervention. We were lucky that they were willing to have a control group who didn't get anything yet, right? So they wanted to see what cash does alone compared to a control group, and then they were willing to have other villages where they add on these village level information meetings and home visits.
So yeah, you already did fantastic research in Burkina Faso, and publishing this kind of study in academic journal is one thing, but ensuring that real policy change happens is another important issue, especially in developing countries. And how can economists, policymakers, and the general public work together to ensure that the research like yours influence real-world decisions, given that probably some people in the government will put politics in the first place?
Sure. I mean, that's a challenging issue, not just in Burkina Faso, but around the world. That's certainly a large challenge. A couple of things I would say is that, first, this program, because it was implemented in collaboration with the government in Burkina, there is some buy-in already at the ministry that they're, hey, we know we're doing this project. We've helped design the project in a way that we, the Burkina Faso government, cares about the answer that we're going to find as researchers. And so then the hope is that, as we conclude, we should say that, we have not finished all of the analysis that we're doing. We're still in process, and in particular doing the cost-benefit calculations. But hopefully that once we're done, there'll be presentations to the government to say, okay, here's the findings. We've done this impact evaluation. Here's what we found works well. Here's what we found doesn't work well. In particular, the cash plus information meetings don't seem to be particularly effective. And so that will help guide them in saying, hey, if we're just going to go out and do these information meetings, we may not be spending our money wisely. Now, will they for sure adopt our recommendations? I don't know. I hope so. But I can't promise that. But, I think in terms of meeting with them, having a policy relevant, we'll have a one-page policy brief kind of summarizing the results. There'll be some meetings with the stakeholders involved. Hopefully we'll be able to maybe go back out to the region that the project was done in Burkina and kind of have a sort of a debriefing with the families, kind of explaining what we found, what worked, what didn't work, maybe kind of learning about from them, hey, why didn't the information meetings work? What you went to these meetings, why didn't you do kind of what they were talking about, kind of furthering, the discussion, which I think is super important in terms of thinking about, how do we translate academic research into policy?
Okay. Now I'm going to move on to the last question in this podcast. So your study measures medium-term effect, but what do you think about the long-term, especially because the government is still not making clear decision on what to do after the research, and also what are the unanswered questions, and what future research is needed to understand this, the full economic and social impact of this integrated cash transfer program.
Yeah, so that's a great question. Looking forward, I mean, so there's, we should be clear, right? So most impact evaluations are very, very short-term projects, right? And so you have a baseline, you do an intervention for 1 year, 2 years, maybe 3 years, and then you have an end-line survey right at the end of the intervention. That's the standard. And so in our case, we came back, 15 months after the end line, after the intervention ended. And so we can start to say something about whether these impacts fade out over time. So to be clear, we had the program. It lasted for a little over 2 years, and then there was a year and a half break, a 15-month break, before we came back to do the end-line survey. And that was driven by COVID delays, driven by insecurity delays in the country. And so those allow us to say something about what we refer to as medium-term effects. It would be fantastic to come back 10 years later, 20 years later, to follow up to see if we have those long-term effects. But already just coming back 15 months after the program ended is sort of much, much longer than is typical in many RCTs. So already, governments, the Burkina government can know, like, hey, if we do this program in another area of the country, and we do it for 2 years, we could expect, and then we stop. These are some of the medium-term effects that we might expect to see. Will they last? Will they continue to fade out? Will they remain strong if we come back in 5 years or 10 years? It's sort of an open question, and hopefully we can find the funding to go back there in 5 years or 10 years and do a follow-up. We're in the process right now. We did a previous project with the Burkina government looking at different ways to deliver cash transfers. This was about 15 years ago, and so we're looking for funding now to go back and do a follow-up. We found these big education and health effects from these cash transfer programs, and so now we're looking for funding to go back and find these families and these kids who got additional schooling, and to see if there are big impacts for them that last 15 years after the program ended.
Right. So that's very interesting and insightful talk, Richard. Thank you again for coming to this podcast. And before we conclude, I like to summarize some of the important findings from these talks, like government's presence and also government's partnership, ownerships is important in the successful of our program. And also oftentimes we need to take into account the need at the household level. If they are not really knowledgeable on the basic or something that we assume to be basic information, then we need to provide that to accompany the cash transfer program. And again, thank you for coming to UGM for the last few days, and also to this podcast. We hope you enjoy Jogja. And audience, that concludes our research series today. I'm sure we have learned some important knowledge from the talks, and I'll see you in the next episode. Thank you.
Thank you very much.
Research.